My name is Paul Lorenz. I'm the Chief Executive Officer for Santa Clara Valley Healthcare. I really want to thank all of you for coming out to celebrate the groundbreaking of our new Child, Adolescent, and Adult Behavioral Health Services Center. The new state-of-the-art facility, along with hundreds of dedicated healthcare professionals, will have a lasting impact on the lives of individuals and families for decades to come. To Supervisor Susan Ellenberg, who serves as our president of the board, to Cindy Chavez, who is present here with us today, along with Supervisor Otto Lee and of course Supervisor Joe Simidian. About a year ago, they declared a mental health crisis in Santa Clara County. So with that being said, I think we all understand why we are here today and why this facility is so important to our family members, to our children, to our entire community.
The Child, Adolescent, and Adult Behavioral Health Services Center will offer a much improved home for the care and recovery of adults, youth, and children who have acute mental health needs. It will allow us to decompress other parts of our system so patients can better flow through appropriate levels of care more smoothly. It is a key piece in the broader landscape of the county to expand the system of care across all levels, from acute hospital beds to long-term subacute beds, residential treatment homes, substance use treatment facilities, as well as community-based outpatient care and supportive housing. Today is an exciting and encouraging milestone, and I am so proud to be here with the leaders and partners who together will continue to build out the facilities, workforce, and coordinated system we need to provide excellent care for all of our residents.
So if I speak with a sense of urgency, it's because we have to act with a sense of urgency. We need to act like we're losing these kids because we are in every city and town in this county, which is why we need to open the doors of this shiny new state-of-the-art facility as soon as we possibly can, because these kids can't wait. I am glad beyond description that we are finally going to make it happen, and that what today is just a great big hole in the ground will soon be the kind of acute care facility we have long needed in Santa Clara County for young people in crisis. A sanctuary, a place where young people can safely begin to heal, a place where they belong, right here, close to home.
You know, I was at a board meeting where a number of parents came forward and in their little 2 minutes were telling the story of being separated from their children who had mental health issues, separated from their children and not in a place where they could provide the kind of love and attention that they wanted to while their children were going through such crisis. And I remember thinking how powerful it was for people who were so in pain and going through that process for some of them right then, that they came and sat in a board meeting to say, we need help, and our children are demanding that we change the way we provide services in this county. We heard the need loud and clear. What I'm so excited about this new facility, it will tie together medical, neurological, and psychiatric and mental health services for children, youth, and adults, and help us get the diagnosis quicker and address the care plans faster, because for so many parents, that can take years, and for so many children, they lose so much in that time. That's why what we're doing today is so critical and so important.
With the Board of Supervisors' declaration of mental health and substance use as a public health crisis in our county, we are growing to meet the needs of the people we serve. This new center will help us meet unmet needs and expand our ability to achieve our mission of providing the people of our county with the services and supports they need for better mental health and wellness.
We are so excited about this service center and feel proud that our county to build this with close proximity to the medical services so that no child, adolescent, or an adult will go without getting the correct treatment. This new state-of-art facility will serve all people in Santa Clara County regardless of their age. Thank you to everyone who has made this possible.
I think we all know that the real hard part is going to start the day this building opens. There is so much unmet need in this community, so many families with loved ones suffering from acute mental illness, and I think a lot about what it's going to be like for the folks that go to work in this building on that day one. And they're going to face a crisis. So what can we do to support them? Well, I've got one idea, and thanks to the support from my board of directors, later this year, the Valley Medical Center Foundation will launch a campaign for what we're calling a startup endowment. Because I know two things will be true about this building. First, it will be state of the art. And second, once it's open, things none of us could have foreseen will be needed and needed urgently. So I think the challenge for us as a community is, can we raise some dollars to make sure that those folks that go to work on that first day have every resource they need to take care of our patients?
In partnership, we can do so much more. But first, we need a place to do it. Even as I exhort us, one and all, to act with urgency, to understand that we can't let another day pass without making a place, a space, where these kids can heal safely, securely, close to home. If we can do that, this will be a day we can all be proud of.